and welcome. I'm your host, Neil Howard. Thank you for returning for another segment of Health Professional Radio. In this segment, we're going to be speaking with Dr. Tram Tran, joining us here from Glympse Bio to talk about recently published data demonstrating that Glympse's platform can be applied for sensitive detection for a number of liver diseases. Welcome to Health Professional Radio, Dr. Tran. Thank you for joining us.
Thanks very much for having me, Neil. It's my pleasure.
If you would tell us what your area of expertise is and your current role at Glympse Bio, that'd be great.
Yeah, so my background is as a transplant hepatologist. I'm a liver transplant physician, specialist, and that's my medical background. And I currently am the chief medical officer at Glympse Bio, which is a biotech company that was spun out of Sangeeta Bhatia's lab at MIT, looking at protease activity in the measurement of diseases, and that's currently what I'm doing now.
This is not the first time that we've had a conversation with a representative from Glympse. It's been a couple of years since we last spoke with someone from your company. You were developing injectable biosensor technology for disease monitoring. Give us some insight as to how that technology has advanced in the last couple of years or so.
Yeah, so I think that when you last spoke, it was an injectable version of the biosensor technology, where it was injected into a patient and then measured protease activity, and then urine tests then were detected to be able to give the results of that. But we recognized, I think that that might be a little bit complicated for the patient to have something injected and then measured later on in the urine. And so, of course, in the goal of simplifying things for patients, we've now converted that technology in the past 2 years to a blood test version. So you actually just take a routine blood test that can be done in any doctor's office or any lab, and we take the plasma, which is a part of that blood, and measure that and measure the protease activity within that plasma or part of the blood draw. So it's a simple one blood test type of test now, which makes it a lot easier for patients and for clinicians. So that was probably the biggest development that we've had in the last couple of years since we talked to you.
Are there other advantages?
I think that that's the biggest advantage, obviously, is to make it as simple and easy as possible. But we've now taken that technology, and now that it's simple, we've been able to look at that technology in non-alcoholic steatohepatitis, which is NASH, or fatty liver disease or active fatty liver disease. And we looked at that in comparison to healthy patients and showed that the protease activity was able to differentiate patients who had active non-alcoholic steatohepatitis or NASH versus a healthy sample. And now, more recently, in this last presentation at the AASLD, which is the American Association for the Study of Liver Disease, which is our big liver meeting of the year, we presented data on liver cancer or hepatocellular carcinoma using this same protease activity test.
Fill us in on some of the findings of that study, if you would.
Yeah, so what we really wanted to do is we wanted to be able to better detect. That's what everybody wants to do, is to better detect early cancer, right? And the tests that we have right now for liver cancer miss up to a third of liver cancer at an early stage. So what we're trying to develop is this panel that can look at the different biological pathways in liver cancer development. So tumor invasion, matrix remodeling, or the changing of the environment in the liver, the amount of inflammation or the amount of fibrosis, and measuring those different biological pathways in the development of liver cancer using protease activity to try to measure those different pathways. So what we did was we took retrospective blood samples from patients that were diagnosed with liver cancer and compared those to patients who had cirrhosis, because liver cancer develops in the background to have a liver that's not too healthy. And then you want to be able to find early cancer or find cancer as it grows, in the smallest sense that you can, in patients who have cirrhosis. So those are the patients at risk. So what we did was we took 54 liver cancer cases and 23 cirrhotic non-cancer cases, and we ran our panel of biosensors and found that we could highly differentiate accurately the patients with liver cancer versus the ones who just had cirrhosis. So the area under the receiver operating curve, or the area under the curve, was 0.87. So we had very good accuracy at differentiating between liver cancer cases and just cirrhotic cases. So I think that's the first step in being able to figure out how do we get to early cancer detection. Now, this is a small number of patients still, and this is a cross-validated study, so we still need to do an independent validation, but I think this is giving us a great early direction that protease activity is another valuable potential test for early cancer detection.
You mentioned the next step in the development process. Is there still a great deal of work to be done on this platform to demonstrate effectiveness? Or you say this is the early stage. What do you anticipate the time frame to be?
Yeah, so I think that there's still work to be done. I mean, I think in the scientific development world of, new technologies like this, we still have some work to do, but I think that we can do this really relatively quickly. And so we're thinking about our next steps in the coming months, really soon, to try to get this, further developed. I think the part that we really want to be able to do is like to test as many samples as possible. And so we really have to be able to find samples and be able to do this testing on as many different types of liver cancer, especially the early ones, as possible. So it's always the challenge is to get good samples, get early samples with the smallest type tumors as possible. And I think that's the way to the next steps in development for a technology like this.
Has there been anything particularly surprising in the testing, or were most of the results anticipated?
Well, I wouldn't say it was anticipated, but I think we're very pleasantly surprised at the performance of the test. I think what's also been also a pleasant surprise is that we found that our assay could detect liver cancer in 22 out of 30 cases of the samples that we have, where the alpha-fetoprotein, which is a test that we already use right now, did not find the cancer. So I think having a test that's better than what we already have, I think is really key. And maybe when we even combine tests together with tests that we already have, we add this on, we could even get perhaps even better performance. So I think what we're starting to learn from this, not really a surprise, but I think part of probably our thinking about this is which tests and or tests together will give us as a clinical population, as clinicians treating liver cancer, seeing these cirrhotic patients, what is the best combination of tests that will give us the best results? And I think we're seeing that because we really could add to it with this type of technology.
Is there anything that you'd like to add for our listeners, and then give us a website where we can learn more?
Yeah, no, I think it's just to add that this is just really exciting new technology. It's potentially applicable across many different diseases that we're interested in. So we've already seen it again in NASH, and now we're looking at it in liver cancer. So I think it's just about the possibility of this as being a really exciting new technology. And people can go to glympsebio.com to learn more. We have some papers on there. We have some videos that they can watch. I think it'll be a good place to learn about the technology.
And that's GLYMPSE bio.com, correct?
Yes, thanks for that.
Dr. Tran, I appreciate you taking the time with us this evening here on Health Professional Radio.
Thank you very much for having me, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Tram Tran. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.